Hello, everyone. I'm Janet Blount, founder of Careers Are Us. Welcome to Where Are the Jobs and How Can We Prepare Our Children for Them? Today, we have Dr. Goldie S. Byrd, Professor of Public Health Sciences and Director of the Maya Angelou Center for Health Equity at Wake Forest School of Medicine. Dr. Byrd conducts research in the genetics of Alzheimer's disease in African Americans with a strong interest in closing the research participation gap in minority communities. Her genetics and community engagement work are widely published and has been presented more than 300 times, including in 9 different countries. Dr. Byrd has received numerous awards for her leadership, teaching, research, student mentoring, and service. Dr. Byrd has contributed significantly to the advancement of minority students and faculty into biomedical and STEM advanced degree programs and careers. In recognition of many years of success in this, she received the Presidential Award for Excellence in Science, Mathematics, and Engineering Mentoring from President Barack Obama at a 2010 White House ceremony. Dr. Byrd, thank you so much for joining me.
Oh, it is my pleasure to be here. Absolutely. Thank you for the invitation.
Well, we'll just jump right in.
Okay, I'm ready.
Okay. Can you tell me a bit about your career path?
Yes, so I'm an Aggie. I went to college at North Carolina A&T State University in Greensboro, and I went on to graduate school from there at Harry Medical College in Nashville, Tennessee. My husband was in medical school and I was in graduate school at the same time. So from there, I worked a little bit at Tennessee State University after I got my degree and did a little postdocing. And then from there, I actually moved back to North Carolina and we had some babies and I stayed home. I came out of the workforce and stayed home for a few years to look after my children. And then I moved from there to North Carolina Central University. We came back to North Carolina. We figured out that we needed the grandparents to help us with those grandbabies. So, and it was their delight to have them around a little bit more. So I had to retool, and then I took a faculty position at North Carolina Central University, which is in Durham, North Carolina. So I stayed there for 12 years, and I went on sabbatical at Duke University to begin my work with Alzheimer's disease, and it was really great to do that because it was right around the time the Human Genome Project was being published, and I wanted my students to understand what that meant toward medicine and their future in health and science as well. So I went there and I began to work on Alzheimer's disease, which is Alzheimer's genetics, which is what I do now, and we have been working on that for a little over 20 years. So at North Carolina Central University, I taught graduate courses, a couple of undergraduate courses. I trained a lot of students. I had one of the largest labs in the sciences there, training students and conducting research. But the Alzheimer's work, after I began doing that, I moved to North Carolina A&T State University, which was really quite nice to go back home to the alma mater and to give in that way. But I was chair of biology there, and I was the first female chair of biology. And then, and that was interesting because I went back to the department where I got my degree. So it was really interesting to do that. It was a great time. I spent 5 years doing that, and then I stepped down. I became an endowed professor for 3 years, and then I became dean for the College of Arts and Sciences, which was the largest college on the campus.
Wow.
From there here to Wake Forest School of Medicine.
Well, how did you become interested in this field of medical research and Alzheimer's in particular?
Yeah, so my research was I was trained as a researcher in microbial genetics. So at Meharry, I studied the genetics of microorganisms, and I studied Escherichia coli, which is a gut bacteria.
Mm.
But then when I decided to change, I wanted to do human genetics. I wanted to look at genetics in human beings. So that's why I went on that sabbatical, because I needed to. I knew genetics, but I didn't know human genetics. So I call myself a lifelong learner, because when we want to do something different, we have to go back and get some training. And I got the training in Alzheimer's through a grant from the National Institutes of Health to support my time away. So the reason I got into that is because I have family members who have this disease. And I watched, as I was growing up, I watched family members struggle with what to do with Alzheimer's patients. They would call it old timers or Alzheimer's or just a little senility. I had an aunt who we put in her daughter put her upstairs in a room and wouldn't let her go out. And she would take her food but her social life just completely stopped. We had I had a classmate whose father just walked away one day, and they never found him. He was never found. And so this disease was really tough on our family. We had several family members who had this, and so the biggest a tragedy for me is that folks didn't know what to do. And so that's one of the things that I knew I wanted to do genetics. I knew I wanted to do it in humans. I knew there was nothing in the literature about Alzheimer's genetics in African Americans at that time. So I thought that was the perfect storm. It was the perfect time for me to get involved with this work.
Mm-hmm, mm-hmm. Now, you mentioned as part of your response to the career path question, the schools that you attended, but can you tell me what type of education, training, or background is required to do the work that you do, a medical researcher?
Mm-hmm. So there are a couple of levels. I have a PhD, a Doctor of Philosophy. So that gives me the education and training to initiate my own research projects. A person with, in our center, we have people with master's degrees, and they contribute significantly. They are study coordinators, they are program managers. So they're able to conduct research with me. But you would need a PhD or a terminal degree to actually get the funding from funding agencies to do this work. So we have many medical doctors here who also do research. So they see patients, but they also conduct research. So I could submit a proposal to a funding agency, and I could have a person with a master's degree as a co-investigator. But they would look for a person with a terminal degree. And when I say terminal degree, I mean like a PhD or a doctor of something, or a medical doctor to get, for the most part. There are exceptions to that, but for the most part, that's what you need. I did not get a master's degree. I went straight from A&T to a PhD program. But many people do. Many people get the bachelor's and then the master's, and then they get a terminal.
And just to reiterate what you said in the beginning, this question is, where did you go to school? What did you major in? And did this help you in pursuing this career path?
Absolutely. So I love, in high school, I loved science. As a matter of fact, physics was my best subject. I think there's a little something wrong with it. But I had a wonderful teacher in high school, and I think that makes a big difference. And then I went on to A&T, and I majored in biology there. My husband majored in chemistry, and he's a medical doctor. So, but and then there are people who major in other areas Many doctors are engineers, mathematics, so we're not limited that way. We would need a scientific background, you know, a substantial amount of science and mathematics. And then I went to Meharry, and again, my PhD was in microbiology, microbial genetics. And so I've done 3 sabbaticals in microbial genetics twice, and then the one in Alzheimer's genetics, because I needed to retool, and I needed to, after 12 years at North Carolina Central, I needed to go and learn human genetics. I learned some of that when I was in graduate school, but it'd been a long time, so I needed to go back and retool. And what we call, I was at a sabbatical, so I took time away from North Carolina Central. I took about 1.5 years, and I went over to Duke University because I was living in Durham. So Duke was just around the corner, basically. And I went to the Center for Human Genetics to do my training.
Now, what skills, abilities, and personal attributes are essential to be successful in this field?
I think to get any type of terminal degree, there has to be a lot of discipline. There has to be an urge to learn, if you will. Discipline, because there are long hours at the PhD level, and even at the bachelor's level, there are many hours of studying, of going to lab, talking to your instructors. So students who want to major in the sciences really have to be disciplined. They have to know how to balance their life, because in college there's so many things to get into, good and bad. And it is a good time to party if you want, but there has to be a balance. And students have to know how to go get help, how to get support when they need it. Not just assume that they're going to get the concepts. They have to be able to go to someone and find the support that they need. And then, of course, at the PhD level, you're totally independent. And so I would recommend knowing how to work in teams, certainly having a high level of integrity, because you're working on research projects and, you know, reporting data, very important. Knowing how to get resources, knowing how to work with people. It is a different level at the PhD, and so the material is difficult. And in my case, I went straight from the bachelor's degree to the PhD, so I had to go find people to work with me and to talk to me. A person needs to be able to get up early, be able to hang out in the lab, sometimes half the night or whatever it takes. But it's usually in teams, and it's it creates an opportunity to really grow up and to.
Let me follow up as far as skills and abilities. If a parent is looking at this video and they wonder, they find this topic is interesting, and they're looking at their student and wonder, I wonder if this could be something they would be interested in preparation for, and I'm talking middle, high school, because sometimes what happens is a student will get exposed to an option their senior year in high school, but they've not taken physics or whatever, just like you said you enjoyed physics in school. What should a parent do, even elementary, middle, and high school, to prepare a student for a STEM career?
You know, I think one of the best things that parents can do is make sure that student can read.
Yeah.
If a student can read well and comprehend, that student is going to be able to do some mathematics. And if a parent can just instill some of those character behaviors, you know, discipline, assure that they're in it, even during a time like the pandemic, You know, as difficult as it is for our children, there should be structure around their day, but and not let them get so far behind because they're going. Many of them are going to want to, but and then sometimes there are opportunities at community colleges before they go off to college, and that I would expose them to everything world. This summer, my 4-year-old and I did a garden, and it gave me a chance to talk to her about the earth and about leaves and stems. And so just everyday things, answer a lot of questions, expose them, take them to museums, take them outside. I mean, there's just so much a student, a person can learn by just walking outside, the sun, the moon, sky, you know. So I think parents can do a lot, and sometimes in our haste, because raising children, I have 3, so raising children can be a handful. But I like the outside a lot. I grew up on a farm. I grew up in the country, and so the earth to me is very interesting, very exciting, and the complexity of the body is exciting, and so everything is science. I'm a little biased.
And I guess
the other thing is the mathematics. So, not that you're going to need so much of it once you get past college, but those critical skills, those thinking skills, those, you know, the ability to write and to think through a situation. Those are the things that parents can help work on, and they can be everyday type things. They don't have to be monumentally, because again, I came from the country, and so we are the first generation in my family to go to college. Neither one of my parents went to college, and so, but all 6 of their children did. So it's that push, and my children laugh at me now because they say, "Well, we knew we weren't going to stay at home, so we had to go." It was like that was just not even an issue. And that was true. The expectation is that when you finish high school, you're going to go to college. And so I think creating those expectations all along the way, and when they get to 12th grade, you know, when they get to 9th grade or middle school, you got to stay out of trouble. And then, you know, 12th grade through 12th grade, your next step is college. Well, I wasn't that polite. I said something like, you're leaving here. So you're going out of my house.
yeah, I'm sure many parents say the same thing. Now, what are some of the common career paths for someone who wants to be a researcher? Or
So in my case, I went to academia. I went to a university. But whether you have a PhD or not, there's so many things you can do. Again, you could be an engineer, you could be a mathematician, you could work at NASA, at space, you know, on space issues. You could work in a lab to test blood. Like right now, there's COVID, so you know, the labs need a lot of people to do testing. You could go into genetic testing, which is when a baby is born, you test to see if that baby has Down syndrome or Tay-Sachs or something like that. So there are many things that people could do. I mean, people can make chemicals, be a chemist. And so the sky is just really open. And many times now what is happening is that people with a STEM background are combining those skills with technology. And so that's a huge area right now. You know, going into what we call bioinformatics, is looking at computer data and working with that data to answer a question. Even with our genetics research, it takes, a good 8 or 9 different kinds of people working on that with different disciplines. So disciplines nowadays are not isolated, but they work with like geneticists work with statisticians and public health people. So we work with any number of different kinds of people. So it's less isolated now. The science disciplines are all kind of integrated.
Mhm.
So there are many different things. I mean, science people are actually in a lot of the factories, like a car company. So you need science people for that. You know, you need science, science in the big corporations to advise and to structure things. So there are just many different, you need scientists in nutrition. How do we make our food, and how do we assure that we're not having germs? They could go work for the FDA, the Federal Food and Drug Administration. So, they're just, the sky is the limit.
Now, what do you enjoy most about the work you do?
Talking with people
Mhm.
and helping people to get um, an understanding of Alzheimer's disease, working with families, working with individuals, working with people who manage, who care for people with Alzheimer's, and just connecting people to resources and connecting them to the research that we do, which is wonderful. Um, and trying to find answers that specifically are tailored to questions that Black people have.
Mhm.
My target population is Black people, and it's one of the greatest gifts of my career is to work with our people.
Now, to follow up on what you just said, why is there a need for more African American medical researchers?
Well, I just read an article that that came out in the proceedings for the National Academy of Science, and that article said that African American babies die 3 times more when they are treated by white doctors. And we already know that the Institute of Medicine came out over a decade ago and said that when we are treated by doctors of the same color, our health outcomes are better. So when we conduct a research project like the one we're doing in African Americans and by African American researchers,
Mhm.
we believe we can have a better relationship because there is a different kind of empathy that happens, because we know how we grew up, we know the experiences that we had, and no matter if you grew up in the city or the country or whatever, there is a bond there.
Mhm.
There is a way that we can communicate that others can't.
Mhm.
We also know that we have a respect for our communities that other researchers may or may not have.
Mhm. Mhm.
And there is science that says that when there is concordance between the researcher and the participant, there's more ease with working as a participant. And so my goal is to fill some of that gap, to make sure that if there is a cure for Alzheimer's or if there is an intervention for Alzheimer's, that our people will benefit as much as anybody else.
Mhm.
And it's only those people that will have the best benefit,
Mhm.
whatever that happens.
Mhm.
And so we've suffered more, twice more, and I want us to be in the receiving line if something comes through.
Wonderful. Now, as far as the work that you do, you told me what you enjoy most about it. What do you enjoy least or find the most challenging?
For Alzheimer's, what's been most challenging is just not being able to hit that magic bullet. Um, this is a very complex disease, and it's not one of those, some diseases you can go directly to the gene and you can knock the disease out. With one like Alzheimer's, it's a complex disease, complex chronic disease. There's an early onset. I mean, there are people at 27 years old who have Alzheimer's disease. And then there's a late onset. Those are people 50, 60 and beyond. The symptoms are about the same. So, and then often people can live decades with it. So that's an inordinate burden on families. It is a burden physically, financially, socially, emotionally, not only to the patient, but also to the people who are caring for the patient. So here we have a disease that's very, very complex. You can't go in, knock it out, knock the gene out and cure. There is no cure. That's the thing that is most upsetting for me, is that we've been working on this disease for a long time, decades. I mean, rigorous working on it, labs all across, around the world. I was going to say across the country, but quite frankly, around the world. And there's no cure. There's no intervention that really slows it down. So once, we get it, it's just so hard. It's hard on the patient, um, but I think it's just as hard on the family and the people who are caring.
What do you wish you had known when you were starting out in this career?
I wish I had started working with Alzheimer's initially.
Mhm.
And I wish I had had um, the courage to do it in Blacks.
Mhm. 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 Yeah.
In terms of looking back over my career, I have no regrets. I've had a wonderful career.
Mhm. Should high school students reach out to people in the field and request informational interviews or other opportunities to learn more about the day in the life of a medical researcher? Or how would you suggest that someone get more information before they make a decision that, yes, this is what I want?
Absolutely. I was just talking to my daughter, who is a STEM coordinator for one of the districts here in North Carolina for high schools. And I said to her, as soon as you can, we want to partner with your school, with one of the schools in the district, because I want the students to come over to Wake. I want them to see what's happening. We can do it if we can wait until COVID is over and do it, face to face. But we could do just what we're doing here today, and record things that students can do. Absolutely, because when a person takes on this career, there are many twists and turns. And I just believe we owe it to our children, because all of them are ours, to give back and to reach back and absolutely, absolutely. We don't have the time today to talk about a lot of the twists and turns, the good things, as you mentioned. I mean, there's so many wonderful things. It's hard work, but it's really great things that are in store for people who want to be in STEM. And we don't have enough Black people going into STEM and the biomedical sciences. And so we absolutely have to help bridge that gap. And we're certainly open here for student Maya Angelou Center for Health Equity at Wake Forest School of Medicine. We're certainly open to students who want to talk to us about a career in the medical sciences.
Wonderful, wonderful. Now, are there any questions I'm not asking that you think I should be?
I'll just leave with this. Again, if there are opportunities that we can continue to partner, continue um, to address either families in Alzheimer's or students who want to go into the area, and actually students should be interested in Alzheimer's, even though we think of it as an old person's disease, but students really need to be interested in aging research.
Mm-hmm.
So I just would, first of all, encourage you to continue to do the great work that you're doing, and know that we're here if we can help in any way to continue the message about students and bridging the gap between where they are right now and a career in the sciences. It's I don't know anything I would have, even in looking back, and I've been in business a long, long time, but I don't know anything that I probably would have enjoyed.
Mm-hmm. Now, I'm just curious, if someone views this video and they have family members who have Alzheimer's, are there studies that they could participate in? And if so, what should they do?
They should contact me, and they can contact me at the Maya Angelou. They can just look me up on Maya Angelou Center for Health Equity. I at Wake Forest School of Medicine, and that's easy. I'm easily found. www.hihg.org. They can call me on my number, on my personal number, if they would like to call my personal number to discuss the family. And just call me at 919-218-8007. Just Maish at is another one
Mhm.
that they can use.
Mhm.
And so we're easily found.
Mhm.
I'm going to give you the coordinator's toll-free number, which
Great.
is 1-833-491-2817. I'll say it again, 1-833-491-2817, or 1-877-686-6444. So we are easily found, or just type my name in to Wake Forest School of Medicine, Maya Angelou Center for Health Equity.
Wonderful. Wonderful.
We have several studies of our own, and then we have an Alzheimer's Disease Research Center here as well. So there are many projects that people can get involved in.
Wonderful. Wonderful. Thank you so much for taking the time to speak to me and share this important information. Thank you so much, Dr. Byrd.
You are so welcome. It's my pleasure, and let's do it again.